NHS England has launched a campaign urging parents to take their children to their local pharmacist for minor illnesses instead of visiting a doctor or an A&E department. 18 million GP appointments and 2.1 million visits to A&E every year are for self-treatable conditions, which cost the NHS £850 million. Well, by visiting a local pharmacist first, pressure could be eased on doctors and emergency services. Well, joining us now from Lincoln, A&E doctor Kishan Rees. Good to talk to you, Dr. Rees. It's a good idea, this, isn't it? It's going to take pressure off A&E departments and GPs as well.
I think we need to look at it in the bigger picture in terms of, firstly, it's 0.7% of the NHS budget. So while 850 million sounds a lot, in the grand scheme of things, it's a relatively small amount. And we need to be careful that patients are getting the right care. Because interestingly, when your researcher got in touch with me yesterday, I looked into this, and in NHS Wales in 2015, they had a similar push, and the Royal College of Emergency Medicine came out and they said that we shouldn't be getting patients to make a decision about their treatment when they're unwell. What would be far better is having situations where you've got a hospital, you've got out-of-hours GP, and you've got pharmacists on the same site that run 24 hours a day, so patients can access those services and get appropriate care. And I think it's worth bearing in mind that pharmacists are operating in a very difficult environment currently, because we've seen the closure of 200 Lloyd's pharmacies last year. And also Ian Strachan, who's the chair of the National Pharmacy Association, he's kind of saying that there's an uncertain future for the 7,000 independent pharmacies across the country, given funding constraints.
But they are supporting this move, it seems, that this has been backed by pharmacists. And I suppose you could argue that it would give them greater reason to keep pharmacies if they were also providing sort of drop-in advice, in terms of medical help. I mean, as somebody with small kids, I do recall going to the GP. You do panic a lot, especially when it's your first, and going to the GP with children with coughs and things like that, and being slightly sent home, not with a flea in my ear, but being told just, bed, Calpol, and lots of fluids. Isn't that's the problem, isn't it? It's people taking up time when actually those valuable 10-15 minutes could have been spent with a patient who genuinely is ill, and that's what it seems this is trying to achieve.
I think we need to be really careful about blaming patients in terms of this is something that we all pay for. We pay our national insurance. We don't want to waste it. Of course, people don't. But the tragic case of Melissa Whiteley in Leicester, when I was talking on the papers on Friday. There's a quote from her mum, which is saying, we know that when you've got a cold, A&E don't want you because you might waste their time. This is something that patients are paying for. And of course, you need to be sensible. You need to use it. But there's far greater issues in the bigger scheme of things in terms of the NHS. I'm not entirely sure it's on its knees because of minor illness. Yes, it will help partly. Of course it will. And we don't want people kind of wasting services and time. But equally, putting that decision on patients is potentially a problem. And the other thing is, will pharmacists be getting training and funding, and will they be appropriately supported? Because I put something out on Facebook last night and I got 200 comments, and lots of people were commenting on it and saying they're struggling. They're going into pharmacists to get their prescriptions filled, and they're struggling to get them. There's not the private areas where people would like to have consultations and things. So, as I said, it sounds seductively workable, but if you look deeper down into it, there are some other issues to be addressed.
In terms of being an A&E doctor like yourself, I mean, what proportion of the people you see do you reckon didn't need to come to A&E at all?
So where I work, we have an out-of-hours GP for a lot of the hours as well, so they get streamed directly to that. Not many, to be honest. I think what we need to be really careful of is what I see more of is patients getting the messaging, you need to stay away from A&E, you need to stay away from A&E, and then they present late, and then they're sicker. As an A&E doctor, what I would prefer to see is more slack in the system, which is more funding, more staff, more nurses, more beds, so that there is that slack in the system, because the whole system is running almost on empty. So it's a really small proportion of patients that I see. The report in Wales in 2015 said that 15% of attendances shouldn't have been there, and that was the Royal College of Emergency Medicine that came out with that. So it's not a massive proportion. It's not the reason that the health service is struggling at the moment.
OK, Dr. Kishan Rees, good to talk to you. A&E doctor, thanks very much.
Cheers, Jane. Thanks.